In the last 3 weeks, we have a new story to tell in Boston, which is at one level a horrible story, but on another level is a pretty amazing story. I grew up in Boston, have lived there most of my life, and Patriots Day, for those of you who've ever spent time in Boston, is one of the most joyous days in our calendar year. It happens the third Monday of April. It's usually a beautiful day. The Red Sox play early in the day. Most of the times they win, and then the marathon starts out at Hopkinton and finishes on Boylston Street in front of the public library a couple of hours later. Obviously, two, maybe more people shattered that day exactly three weeks ago, and so it is a horrible event that we are sort of just recovering from in Boston. On the other hand, on the positive side, this, I think, sort of brought out the best in our community, the best in the first responders, the best folks who triage patients, the best in the various hospitals that accepted these critically ill patients. It also brought out the best in our government officials at both the state and city level, and you've seen across the country what an amazing job law enforcement did in our community. It also has brought the community together in ways that I've never seen before and never really thought possible. So over the last 3 weeks, we have lived this incredible contrast of dealing on the one hand with terrible evil and horror, and on the other hand with an incredible ability to celebrate the resilience of the human spirit and really marvel at the compassion that people can show to one another in times of distress. I wanted to spend a few minutes just sort of going through the sequence of events that happened on Patriots Day 3 weeks ago, and as you have all seen, at 2:50 in the afternoon, at the peak of when runners are supposed to arrive at the finish line in the marathon, two bombs went off on Boylston Street 12 seconds apart. I'm going to spend the next few minutes talking about what happened at Mass General. We received formal word from Boston Emergency Medicine literally within 5 minutes of the bombings to expect multiple casualties. If truth be told, we actually heard through informal means a few minutes before then. Several people in our emergency department got Twitter notices from people who were at the scene, and our chief nurse happened to be walking out of a hotel a couple of hundred yards from where the bombs went off, and immediately called one of her colleagues to let her know what had happened and to prepare the hospital for the patients that would inevitably be coming. Within a matter of minutes, we called what we refer to as code disaster and set up an emergency operations center in our trustees' room. And literally within minutes of that, our first patient arrived, not by ambulance, but by private vehicle. This was a person who had a traumatic amputation, and when they arrived in the emergency room, went into cardiac arrest. Over the course of the next half hour or so, we received 39 patients from the scene by ambulance. They ranged in terms of conditions from traumatic amputations to compound fractures to multiple trauma, and obviously many of these patients were suffering from profound blood loss and shock. One of the features of the bombs that exploded at the marathon is that they were encased with these metal fragments, pellets, and roofing nails, so that patients had multiple soft tissue penetrations by these metallic objects, in some cases as many as 40 of them. So we received 39 patients within about a half an hour. 12 of them were sick enough that they needed to be admitted to the hospital, and of those, 6 were sick enough that they needed to be transported literally within minutes to the operating room and ultimately to intensive care units. Not only did we receive a large number of patients, but our colleagues, our sister institution, the Brigham and Women's Hospital, received a similar number. Excuse me. And our colleagues at the Beth Israel Deaconess, Boston Medical Center, Tufts Medical Center, and Boston City did as well. Excuse me. Luck clearly played a role in the response to the marathon events. And let me say that we're very proud in Boston and in the medical community that all 250 of the patients who were arrived at hospitals alive are still alive today. And I think some of that was due to luck, but some of it was due to something other than luck. On the luck side, Within about 100 yards of where these bombs went off was a major medical tent that was housed dozens of doctors and nurses there to take care of marathon runners and normally taking care of things like dehydration and musculoskeletal injuries. Those people did an amazing job responding as first responders and helping to stabilize and then triage patients as well. In addition, there were a large number of ambulances on the scene with EMT crews, so that was a lucky phenomenon as well. So where these bombs went off, in some ways, was very fortunate. The other thing that was very fortunate is the time of day that this occurred. As most of you know, at 3 o'clock is the change of shift at most hospitals in this country. And so when these patients arrived in our emergency room and then in our operating rooms, we more or less had twice the shift we normally have because the day shift stuck around and the evening shift was arriving. So that was enormously helpful. On the something other than luck side, we in Boston have taken emergency preparedness extremely seriously ever since 9/11. There have literally been dozens of citywide drills simulating different disasters that we as a community might face. And just within this past year, a disaster not too dissimilar from this one involving a bomb going off in an airplane at Logan Airport was carried out. And so I think the system of triaging patients and then accepting them at the hospitals worked as planned. In addition to that, in Boston, we, on this day at least, were fortunate to have 6 Level 1 trauma centers. The Brigham, the Beth Israel Deaconess, Tufts Medical Center, and Boston Medical Center are all certified as adult Level 1 trauma centers. Children's Hospital as a pediatric Level 1 trauma center, and MGH is both an adult and pediatric Level 1 trauma center. On most days, having 6 Level 1 trauma centers where a number of them struggle to have the necessary volume to be Level 1 trauma centers seems like a downside, but on this particular day, it was a huge help. Because if we had just 2 or 3 of these centers, they would have been overloaded. There was no way that patients could have gotten up to the operating room within minutes, and I'm afraid that people would have died. So having some redundancy in the system and this expertise and capacity spread throughout the city was extremely helpful. We are now, in the 3 weeks later, in the aftermath phase of this tragedy. Most of the patients, almost all of the patients, are now either home or in rehabilitation hospitals, particularly the Spalding Rehabilitation Hospital that's part of Partners Healthcare. We have only one patient left at Mass General. These patients are both undergoing physical rehabilitation, and some of them will ultimately need prosthetic devices, but they are also now coming to terms with what lies ahead of them and the incredible physical and emotional challenges that they and their families are going to be facing in the weeks, months, and years to come. The other people who have been deeply affected by this, however, are our staff. And I was just have some email correspondence with our chief nurse today who went on rounds in some of these patient care units. And each one of them that she visited, people were in tears, even though all the patients had gone and they had all survived. This is our staff, and I know your staffs are trained to deal with tragedy, but to see such tragedy in such large volume and to see it intentionally caused, I think took a real toll on the staff as well. Operationally, the day of the marathon was not the most challenging day that we faced. The most challenging day that we faced during this entire episode was several days later when this incredible manhunt was going on within the city of Boston, and the governor put in place a shelter-in-place order asking everyone within the city and some surrounding communities to stay in their homes or where they worked and not leave that particular domicile. The public transportation system was also shut down at that time. We were unable on that day to get patients out of the hospital because they weren't supposed to leave. And we have 5,000 patients who take public transportation to get to the hospital, so they had no way of getting there as well. So operating the hospital, caring for a full hospital of patients during these circumstances was incredibly challenging. But in some ways, from an operational standpoint, that was the most difficult day that we faced. I just want to close with 2 final comments, and that is The support that our patients, our staff, and our community has received from each other and from around the country, around the world, has truly been breathtaking. We had visits at Mass General from the President of the United States, from our governor, from several of our sports teams, from people who have had amputations and wanted to share their hope and experiences with our patients. We also, in Boston, have raised close to $30 million through the One Boston Fund, which will ultimately be used to support these patients and their families. It was recently announced that each of them who suffered amputations will likely receive at least $1 million each. We've also had some wonderful things sent our way by other providers from around the country. Pizzas sent to our emergency room, Texas barbecue delivered personally from Waco, Texas, from a hospital there that we were very grateful for. So the outpouring of support has been extremely welcome from these patients, their families, and from our staff as well. And finally, I just want to close with one last message, and that was characterized both on TV and in an article that I'll quote from that was entitled, "You Messed with the Wrong City." Stephen Colbert, I think within the night or two of the bombing on TV, said to whoever was responsible for this that they messed with the wrong city, because after all, this was a city that endured 86 years in between Red Sox World Series championships, and also had endured 16 years of traffic gridlock as a result of the Big Dig. So that provided a little bit of needed humor during this episode. But more importantly, Dennis Lehane, the novelist, wrote a wonderful op-ed piece in the New York Times entitled Messing with the Wrong City, in which he wrote, and I quote, "Boston took a punch on Monday, 2 of them actually, that left it staggering for a bit. Flesh proved vulnerable, as flesh is wont to do, but the spirit merely trembled before recasting itself into something stronger than any bomb or rage." So again, I want to thank you for your attention. Appreciate the opportunity to say a few words about what we've been through in the last few weeks. Thank you.